right. Welcome back to Vegas Unwrapped. Time flies when you're having fun, isn't it?
No question about it. By the way,
That's what they say.
I got to give a quick shout out to Cammie, who was listening,
Yes.
but lost her connection, but now is back on.
All right.
So now she'll have to listen to the podcast to hear about all the nice things I said about her.
Or she could go to YouTube.
Or she can go to YouTube and
the
watch
YouTube
it
video.
tomorrow, sometime
That's right.
late in the afternoon.
That's right. All right. So, good job. Good job. Does the president ever listen to the show?
The president sometimes listens to the show.
He should have been here with all of our members that came to get their stuff tonight.
It was incredible. The turnout was beyond belief.
That's right.
Unreal.
He should have been here to thank everybody.
Well, we'll get him on. He wants to see Bob Backlund.
Yes, we'll talk about that a little later.
Badly.
Yes, I
Okay.
figured he would. All right, we want to welcome at this time our good friends over at Compassion Care Hospice, Miss Samantha and Nicole. Sam is what you prefer, right? If I remember last time? Okay, see, I remember that stuff. Welcome, ladies. Go right into that microphone, pull it towards you there. Nice to see you guys.
You too.
Welcome back.
Thanks for having
Always be
us.
part of Vegas Unwrapped. How's everybody over there? Lori, everybody good
Very good.
at the shop?
Yes, very busy
Yeah.
New Year.
I almost hate to ask what makes it busy for Compassion Care Hospice. I mean, what do you gauge to say that is it busy because you're marketing so much? Is it busy because obviously increasing clientele? I would hope, but not, it's kind of hope people are bad enough to, you know what I'm saying?
Right.
So-
Honestly, right now with the flu season,
Right. Oh, yeah.
we've picked up quite a bit. And then just after the holidays, sometimes it's hard during the November, December months for families to make decisions.
Sure.
At the first of the year, we tend to kind of get a little bit more busy.
No, really, that's a great point. I didn't even think about that.
The flu season has brought out some very, very scary numbers. 5 children.
Yes.
That's really, really sad. So what do you guys do in terms of dealing with that aspect of hospice with the flu stuff, with the older people?
We actually do have some patients in facilities who picked up flu-like symptoms, and we do treat them for the flu. So it's not something that we ignore. But we treat them to the best that we can with everything going on their day-to-day basis, too, and their medical care.
Wow. Yeah, this flu thing is just crazy, and it'd be a whole nother topic for a whole nother show. But, all right, so tonight, you want to talk about what now? The difference between...
We definitely want to touch on inpatient placement
Okay.
versus our crisis care program.
Gotcha. Okay, so let's start off by explaining the difference between the two.
Okay.
Let's talk about the in-care. Let's start with that, and then we'll go to crisis. So share your thoughts on what that is.
Okay. Well, an inpatient, or what's called an IPU in hospice terms, is short-term placement for somebody that is on hospice services that needs symptom management. So, for example, if they are having extreme pain issues, shortness of breath, something that is uncontrollable in the home setting, and they need to be moved to an inpatient unit to take care of those issues.
Okay.
And then our crisis care does not involve any inpatient unit at all. It's a special program where our patients stay at home. We treat them at home so we don't have to move them to an inpatient unit. We have a nurse that comes to their home and will stay with them for a minimum of 24 hours or longer, depending on the situation, to treat any of those symptoms.
Okay. Now, explain what an inpatient unit would be. What is that? What does that mean?
Inpatient unit is either a hospice unit or another hospice place in a rehab, hospice
Okay.
rooms in a rehab.
Gotcha.
A lot of times people are admitted to hospice and they're placed in these inpatient units, but then shortly after they're either going to have to relocate back home or
Okay.
into another facility. Which is a lot to think about if you're going through the emotions of putting your loved one on hospice and then realizing a few days later that you have to move them.
Gotcha.
So our goal with the CC and the crisis care team is to keep the patient at home at all times. So your loved one is home and you know they're comfortable.
Right.
And there's a licensed nurse sitting there with them to either medicate, clean, keep them 100% comfortable.
Right.
Again, without having to leave the home.
Gotcha.
I think it's amazing that you can do that, because I know that when somebody is in in hospice, away from the home, the loved ones just don't know what's going on.
Right.
Whereas if they're in the home, they have the feeling that everything is close by, and if anything should happen, they're there, and that's important.
And I want to clarify for our listeners who may be hearing of Compassion Care for the first time or don't recall, but you guys are primarily an in-home provider, unlike another hospice center that's here in town, which I won't mention their name. You guys can mention that in our discussions, as we were talking about before the show, if you want, where they have a facility where they have rooms where you can go and be taken care of, versus what you do, and that's primarily the goal of keeping them at home and servicing their needs at home.
Right.
So I wanted to clarify that for a listener that's here, maybe hearing this for the first time.
Well, and that's the main thing to understand is an inpatient unit is basically a very institutionalized, lack of a better term, like a hospital setting.
Right.
There's, I think, 10 or 12 beds in an inpatient unit.
Okay.
Like I said, you feel like you're in a hospital room,
Right,
where
right.
a lot of people don't want that. They want to be in their own bed and sleeping next to their spouse, or be able to relax at home on the couch when they're feeling well.
Sure.
Not be in such a setting where they feel like they're in a hospital. So,
And a lot of people are nervous, especially if they're starting out in the hospital or in a rehab and they're first referred to hospice. The spouse or the family gets nervous to bring them home. How am I going to take care of them? I can't do this. He's in pain. That's when we, don't worry, we're going to get them home. That's the goal. Most
Right.
patients don't want, and I don't mean, to sound blunt at all, but most patients don't want to die in a hospital.
Of course.
They
Of
want to
course.
die at home. So our goal is we'll get them home right away. We'll keep that nurse there, make sure they're comfortable, make sure their spouse understands all the medications, all the care that we're providing. And then once we feel that the patient is comfortable and the family is comfortable with them at home, that's when we go back to the routine care where you get the, the nurse visits weekly or more if needed, and, keep a close eye on everything.
I think what most people that don't know enough about hospice believe that once you're in hospice, the end is like a day or two away.
right.
And that's not the case,
Correct.
especially when you're at home.
Correct.
Okay, so that's something that people should know about, because, like I said, very few of us, before we have these young ladies come in, really explain what hospice was, because our experience with hospice was with a friend who seemed to go in and out, because, every time he went in, we thought he was
He
going to...
dodged the bullet so many times.
Yeah, and...
Getting into hospice, leaving hospice, thinking that was it, and
Right.
just crazy.
Well, and we see that a lot too with people that have maybe symptoms that are back and forth, like you said. They need to be controlled, and then they're under control. And that's the nice thing about crisis care is you stay at home. We're not moving
Right.
you to an inpatient unit and then bringing you back home, and 2 days later we're moving you again.
Because all that moving around can't be good for the patient
Absolutely
anyway.
not. Yeah.
So, wow.
Especially
Interesting.
if there's like a diagnosis of Alzheimer's dementia, that could be the absolute worst thing to do to a patient.
Because they sort of lose their home base, so to speak, of what's normal for them, what's
Yep.
familiar, right?
Exactly.
Wow.
Mhm.
And there is, we do stress, and our number one goal is to keep the patient home and comfortable.
Right.
However, if something's going on at home where there's, the spouse doesn't want the patient home or whatever the family dynamic is, we do have inpatient where we can place.
Okay. So you have
Temporarily
arrangements with
until-
facilities and,
Right.
and whatnot around town. Okay.
Right.
Interesting. Interesting.
There's a lot of misconceptions, though, and a lot of people misunderstand how an inpatient unit works. I don't know
Okay.
if we have time to talk about that.
Why don't we
right
save
now.
that for the other side of the
Okay.
break? That's a great segue. We'll talk about that.
Well done.
You've been on radio before, haven't you?
Have you done this?
I have.
All right, you're listening to Sam and Nicole from Compassion Care Hospice. Films and Cash, Vegas Unwrapped, coming at you, 702-483-4444. Give us a call, ask your question, or you can Skype us, or you can message me through Facebook. We'll be right back right after this. Calling us pain in the asses, and we have a new sound drop from him because unfortunately I run with them on Wednesdays. They've decided to end their show.
Yes.
So we will no longer be on their Wednesday show, but we still will be on their television show.
Right, that's for sure. In fact, this Monday, we're going to go shoot some new
You have to
new
confirm that,
shots.
don't you?
No, it's done. 1 o'clock.
Yeah?
Yeah,
I thought it
definitely.
needed to be confirmed.
No.
Oh, I haven't put it on the calendar. So you may have been there alone had you not said that. All right, welcome back. We're here with Compassion Care Hospice. Nicole and Sam are here. And right before break, you brought up a great point about misconceptions. So let's kind of pick up from there. And what are some of the misconceptions about the crisis care and the inpatient
unit?
Thank you, IPU.
Well, again, just to reiterate, I know we've probably said it a lot, but hospice is a service. A lot of people think it's a place that you go
Right.
to pass away. Not the case. It's a service provided to you at home. So again, home can be a private residence, an assisted living, a nursing home, a group home, all of those types of things. But when you are considering choosing an inpatient unit, or your hospice tells you that you need to be placed in an IPU, it's very important to understand that, again, that is short-term placement. It doesn't mean that you can live there. You can't stay for, say, 2 weeks, and then I want to go home. That's not how it works.
It's not a rehab center or a
Correct.
recovery
Right.
center or whatever.
It's strictly for symptom management. So as soon as your symptoms are under control, if you're having pain and that's under control, whatever the case, as soon as you're better, you have to leave that inpatient unit.
Okay.
And that's something a lot lately that we've been dealing with out in the community with some organizations that have inpatient units, is that we feel people are being misled or they misunderstand
Okay.
that they cannot stay there.
So the misinformation is that they can stay there no matter what, is what you're saying. I just want to make sure that we're clear on what the error is or what's out there.
Yeah, they feel that they can stay in this IPU for as long as they want.
Gotcha.
And then a couple days later, we're getting a phone call saying, wait, why am I being told that I have to go home?
Gotcha.
So
Okay.
it's very important for people to understand that it is just short term.
Okay. Now, from what I remember in our previous conversation with you guys, though, when you do your initial intake process, you are reviewing what hospice is. You are reminding them that it is a short-term care. It is symptomatic care. It is all that stuff. So, in a way, it shouldn't be a surprise at the end.
Correct.
But yet, I know you guys cover that at the beginning of the process. So there really should be no confusion.
No, but there's times where, like we were talking about before, if people aren't educated about hospice or it's something that's sprung on them, when you're dealing with emotions or you're dealing with a loved one that's declining very quickly, sometimes you hear things, but you don't really hear them.
Sure.
So, there can be some misunderstandings and things like that. But again, with our crisis care, we truly believe in keeping the patient at home and not having to go back and forth and move them, especially like we talked about with the transportation. Sometimes that can really take a toll on someone if they have to be moved several times. So doing everything that we can to manage symptoms at home is what we love to do.
Sure. Really, one of the best things that we can advise any family or any family member who's looking at hospice, do your research in terms of understanding what hospice is first, before perhaps contacting a provider like you guys, so that what's the old saying? There used to be a commercial back east that used to run where the tagline was, "An educated consumer is the best customer."
Correct.
And because hospice has really, I think, skyrocketed in its use nowadays because of society and our older generations are in more need of it, that people need to educate themselves on really what it is.
Right.
And I think that helps and goes a long way with understanding the relationship between a provider and a patient.
Well, the baby boomers are certainly living quite a bit longer, and they're more educated in terms of what's out there, and it just seems to me that somebody would rather be sick at home, or even worse, but at home with their loved ones, rather than being in a hospital or a hospice where they're waiting for the
Look, I hope to God that nobody in this room and any of our listeners should ever need hospice care. But last year, when I was sick for 17 days, I was in the hospital 4 days at Summerlin Hospital, and then I was in a rehab center for 13 days because of a cellulitis attack I had. So I was down for 17 days.
Wow.
And I was nuts. I was crazy. I was my skin. I was trying to climb out of my skin because I was just going crazy. I wanted to be home. So the feeling of being in comfortable surroundings and being in those comfortable environments and in that familiarity is mindset. It goes a long way to help with the proper mindset you need to heal.
Right.
So, I mean, I know what I felt like. I mean, you were in the hospital when you had your bypass surgery. I mean, anytime you're tied up and you're not in that home environment, but I would think it's exponentially worse in the situation of hospice, where the patient kind of knows in the back of their mind that this is it,
or this could be
or
it.
this could be it, and so my God, to have the choice of either being in unit or at home, I would think 99.9 out of 100 people would rather be at home with their family and be in their comfortable surroundings, and it's just crazy.
The only people that I would disagree to a certain extent with that is people who are so selfless in terms of thinking about themselves, and they think about their family, and they don't want them to see the family suffer. So,
But I don't think that's a bad trait.
no, I don't either. I don't either. I'm just saying, but
you're right.
there are some people that would rather be alone because they don't want anybody to see them
Right.
deteriorating.
Yeah, I agree with that. I agree with that too.
How Samantha mentioned earlier, sometimes even if the patient is telling us they really just want to go home, but their spouse or their caregiver is the one that's, I don't know if I can do this, they're very anxious. That's the great
Gotcha.
thing with our hospice services, is that we are available 24/7. So it kind of is, a comfort to the family or the caregiver or whoever, to let them know, if it's 2:00 in the morning and you're feeling uncomfortable about something, or you're not sure if the medication's working properly, you can call us and you're actually going to speak to a nurse.
Right.
So we're there for our patients and our families day and night.
www.cchlv.com.
Yes.
Not bad off the memory banks is the website for more information about
I actually thought you were cheating. And
I did. Do I not have a white screen?
I'm
You
impressed.
remembered.
I don't remember the phone number though, so give the phone number to the facility.
It
to you guys.
is, of course, 702-636-0200.
I knew a 2 was in there somewhere. I just couldn't remember besides the area code. But no, check out the information. And I know Cash and I, over the time that we've been working with you guys, and again, we're honored to have you guys as supporters for us. It's been a great education for us to learn so much about the process of hospice and what it is, and really what differentiates you from the rest of the providers here in town. And I can't say enough, the thought and philosophy of keeping a patient at home as the main goal in their comfortable surroundings during this time of crisis is paramount to me.
I know we've educated a lot of people
Yeah.
with the commercials, with your appearances here now. What is it, like 3, 4, 5 months?
It's been long.
Yeah, it's been
Believe it or not,
long.
we're coming up on almost a year.
Wow.
Yeah.
Because I've gotten many comments.
Oh, absolutely.
I mean, along the way, I've gotten a lot of comments from regular listeners, and then people that say, "Oh, you're the ones that promote
Right.
Compassion Care."
Right.
It's nice to hear that. too.
Absolutely.
Yeah, we do free assessments. Well, everybody does, but Samantha runs our admissions team, and
Right.
she has amazing nurses that will come out and meet with families. So if anyone has any questions, please call us. Just because you want information doesn't mean we're going to sign you up.
That's right. It's a no obligation consultation. The disclaimer. Very cool. Now that's good. So what else is coming down the pike for you guys? Any new marketing? Any new things coming down the pike for you guys? What's happening over the next 6 months or so for Compassion Care? Anything that you can share with us that Lori won't get mad at?
I'll guess that they need more staffing because
They're getting busier.
Yeah, because you must be real busy.
That is true.
We've been hiring a lot. We're still trying to wrap our heads around everything that's happened during the holidays,
Sure.
since the holidays came to a close. Still backtracking and going over everything, how busy we've been the past few weeks.
So your
hopefully
office staff is kind of busy?
Office
yeah.
staff is good, but we're always, if anyone's interested, they can go online and look at our job postings. We're also always
CCHLV.com.
looking for volunteers as well, for our volunteer
We have
department.
great volunteers who really help our
Talk about that. We talked about that last time, I think, that when you guys were here live in studio. with
And it
us.
was amazing. So let's hear about it again. if
Talk
you
about what
can.
the volunteers provide in the program for a hospice patient.
We have a ton of volunteers, some who just go and spend time with patients who want someone to talk with, and then some who have specialties like things, essential oils, animals, music, art therapy, anything that would really put a smile on the face of someone who needs it. Any kind of interest you have, like I said, if you used to be in a band, we have volunteers who play music or have bands. You used to love to paint, we can have a volunteer come and paint with you.
Wow.
You know, there's a ton of options, and we have a lot of great staffing in our volunteer department.
So how many volunteers do you currently have now, roughly?
Oh gosh, I would guess.
Whether they're full-time or part-time, it doesn't. I'm
Right.
just curious how many volunteers you have.
I would say close to maybe 20. That's a guess.
That's not bad.
Yeah.
That's great.
I know they're spread out all over because we
Sure.
service all of Clark County, but I know, like, in particular in my area, I have quite a few actually that come into my assisted livings and will even, like, run the bingo
Okay.
for assisted living facilities. So,
We used to do that with
Kiwanis. We used to do that.
Yeah.
One of the, yeah, absolutely. That was fun. Well, you know what? If you have any events going on collectively or whatever, you guys know to let us know what's going on. If we can come down and help out or make an appearance or cover it, or you want us to announce anything that's going on, please, by all means, just let us know, and we'll get it out there for you guys.
absolutely. I know with all the health fairs coming up and
Right.
the senior
Yeah, you mentioned
spectacular
that.
in March,
That's
we
right.
will definitely have a booth there. So if people are out, come
And
and
we
see
will
us.
be there too. I'm
More
sure.
than likely. I'm sure my phone will ring from Nina here momentarily.
Yeah, really.
Let us know what's going on. But I want to MC the stage production. That's
Yeah.
one thing we got to do.
I know.
So, Nina, we want to MC the stage production this year. If not, we'll take a table, and because we did very well. John made a lot of great contacts for us last year.
It was terrific.
And of course, we met these guys there almost a year ago.
Yes.
It's going to be a year in
is.
March when we
March,
watch it.
right.
Yeah.
Do
Yeah.
you know when it is in March? Do you have a date yet?
I think it's the 14th, 15th, something like that.
Right before you go away.
That's
The
work.
weekend
That'll
between
work.
us.
That'll work
So,
great.
very good.
That'll be
Guys, thank you
fabulous.
so much for popping in again. We appreciate it, and educating our listeners, and again, your support of our hospice community, I think is so critical, is so important, and we're honored to be working with you guys and helping to get the word out and educating people about the hospice, I don't want to say industry, but the hospice care that's available for in-home. And I
Yes.
want to stress that. This is in-home hospice care where the patient, the client, your relative, whoever's in need of hospice service, stays at home in their comfortable surroundings with friends and family or whatever, to be comfortable through whatever time they have left.
Yep.
Quite frankly, exactly where I would want to be.
No
At
question.
home. No doubt.
But I could also see you and I being that selfless person you mentioned, where we wouldn't want the family to see us
It's a
suffer.
it's a little
I could
bit.
see you and I in that argument.
Yeah,
with the
I
family.
know because and I get it, but you know,
Absolutely.
and-
You guys could share an apartment.
Oh,
There you
great.
go.
Yeah, great. The real odd couple.
we've already shared 6 years of this,
Right.
plus another 12 on top of that.
Absolutely. Guys, thanks. Say hello to Lori and everybody for us back at the ranch when you head back there tomorrow. We look
We
forward to your
will.
visit next month.
Yes.
We appreciate it.
Thank you.
All right, Vegas Unwrapped, that's Compassion Care Hospice. CCHLV.com is the website. Check it out for all the information that you need when the time comes for your hospice in-home care here in the Las Vegas area. When we come back, you know what time it is, Mr. Cash?
Doing it with styles.
Doing it with Styles. JPEG comes out in front of the camera. You, the listener, don't go anywhere. We'll be right back.